Hi, Dr. Lucky Seacon, fertility doctor, bringing you this week's Fertility Fact Friday. So this week's question is, will the injectable medications used to stimulate my ovaries during IVF impact the quality of the eggs? The reason people worry about this and ask this question is because it's based on this idea that normally in an ovulation cycle, when you're not taking medications, there's a bunch of eggs at the surface of the ovary and your brain sends out that signal to select one. And a lot of people think that there's some quality control involved in that selection process. The assumption is, well, if you're using these IVF drugs to try to select a bunch of eggs that were never destined to be selected, they're obviously going to be of lesser quality. So we know that this is not true. The selection of a dominant follicle and ovulation of an egg is a completely random process, like a lottery. And we have published data. This study was done by RMA a few years ago, and we proved that there was no relationship between the dose of medication given to stimulate the ovary during the course of the IVF cycle and the likelihood of the resulting embryos being genetically abnormal or normal. I know this is a shameless plug, but check out that first authorship. And here's another study, this time comparing natural cycle IVF, where no medications are given before retrieval, to regular IVF. And look, the chance of having an abnormal embryo was equivalent in both groups. So no, IVF meds do not impact egg quality.